सर 2 मिनट ना, मैम का माइक अनम्यूट होने के बाद अपन पढ़ेंगे।
कोई
यस, पढ़िए सर।
हेलो सर।
यस मैम।
हाँ, बस स्क्रीन शेयर कर रही हूँ, देन आप जब बोलेंगे तो वी विल स्टार्ट।
हाँ मैम, करिए। यस 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 मैम, चलिए। एक यस
डॉक्टर,
नंबर 49 प्लीज रीड।
यस सर, थँक यू सर. डॉक्टर बाबासाहेब आंबेडकर मराठवाडा विश्वविद्यालय छत्रपती संभाजीनगर तथा यूजीसी मालवीय मिशन टीचर ट्रेनिंग सेंटर द्वारा आयोजित 16वें ऑनलाइन फैकल्टी इंडक्शन प्रोग्राम के अंतर्गत मैं डॉक्टर वाई.एन. मोरे, सहायक प्राध्यापक राजे रामराव महाविद्यालय जत, तालुका जत, जिला सांगली, रोल नंबर 49, आज आपके समक्ष संसाधन व्यक्ति डॉक्टर स्नेहल शासस्कर का संक्षिप्त परिचय प्रस्तुत कर रहा हूँ. डॉक्टर स्नेहल शासस्कर वरिष्ठ ऑक्यूपेशनल थेरेपिस्ट. डॉक्टर स्नेहल शासस्कर पिछले 30 वर्षों से अधिक समय से पुणे स्थित रीजनल मेंटल हॉस्पिटल एरवाड़ा में वरिष्ठ ऑक्यूपेशनल थेरेपिस्ट के रूप में कार्यरत है. उन्हें मानसिक स्वास्थ्य के क्षेत्र में गहन अनुभव, व्यवहारिक दक्षता तथा समर्पित सेवा का लंबा अनुभव प्राप्त है. उनके प्रमुख विशेषज्ञता क्षेत्र इस प्रकार है: मानसिक रोगियों का व्यावसायिक पुनर्वास, तनाव प्रबंधन, जीवन कौशल्य का विकास, मानसिक रोगियों एवं उनके देखभालकर्ताओं के लिए परामर्श, जेरियाट्रिक केयर, विशेष रूप से डिमेशिया एवं अल्जाइमर, योग एवं मनोरोग, शैक्षणिक एवं जन जागरूकता कार्य. डॉक्टर स्नेहल शासस्कर का मानसिक रोगियों के पुनर्वास विषय पर आकाशवाणी पुणे से साक्षात्कार प्रसारित हो चुका है. महाराष्ट्र शासन की प्रतिष्ठित पत्रिका आरोग्य पत्रिका में उनके विभिन्न मानसिक रोगों में ऑक्यूपेशनल थेरेपी विषयक लेख प्रकाशित हुए हैं. इसके अतिरिक्त डिमेशिया केयर पर उन्होंने सरकारी यूट्यूब चैनल के लिए पॉडकास्ट भी प्रस्तुत किया है. व्याख्यान एवं प्रशिक्षण कार्य. डॉक्टर स्नेहल शासस्कर ने कार्यस्थल पर तनाव प्रबंधन विषय पर पुलिस विभाग, कॉर्पोरेट क्षेत्र, छात्रों तथा वरिष्ठ नागरिकों जैसे विविध वर्गों के लिए अनेक व्याख्यान एवं कार्यशालाएं सफलतापूर्वक आयोजित की हैं. ऐसे ऐसे अनुभवी, संवेदनशील एवं समर्पित विशेषज्ञ डॉक्टर स्नेहल शासस्कर का इस कार्यक्रम में मैं हार्दिक स्वागत करता हूं और मैं मैडम से अनुरोध करता हूं कि अपने विचारों से हमें लाभान्वित करें. धन्यवाद.
ऍक्च्युली पण त्यात हे कसं होईल, माझा व्हिडिओ ऑन करू?
मैम व्हिडिओ ऑन करू शकता, मैम व्हिडिओ करा, माइक पण ऑन करू शकता. यस मैम.
ओके, माझा व्हिडिओ ऑन झालाय.
यस मैम, तुम्ही पीपीटी शेअर करू शकता मॅम.
या या कुठे रे आपलं?
अगोदर मॅम पीपीटी ओपन करून ठेवून द्या सिस्टमवरती आणि मग नंतर शेअर करा मॅम.
राईट, पहिलं मेंटल हेल्थ. हा, हेच. आता हे ओपन करायचं आपण वरचं स्क्रीन. हेलो हेलो.
मैडम.
हाँ हाँ, यस, मेरी आवाज आ रही है सर?
जी मैडम.
हाँ, और स्क्रीन भी शेयर हो गया है?
यस मैम. जी जी.
ओके सर, चालू करते हैं. जस्ट मिनिट, मला साईडने त्यांचं काही दिसत नाही का? मला फक्त माझा स्क्रीन दिसतो का? हा, हे ओपन राहत नाही का असं माझं म्हणणं, का गरज नाही त्याची? ठीक आहे, राहू दे, आधीच चाललं होतं ते चालू दे. नको, मला मोठंच लागेल, कारण नाही तर मला दिसणार नाही ते. हॅलो हॅलो. हाँ सर, कैन यू हियर मी? Yes, yes,
Yes,
ma'am.
ma'am. Yes,
Okay,
ma'am. Yes, ma'am. You
okay,
are audible.
okay. So, good afternoon, everyone. We will start with
Good
mental
afternoon.
health. We will start with the definition. So, according to WHO, health is a state of complete physical, mental, and social well being, and not merely an absence of disease. We all know it. Now, we will go to mental health. What is mental health? So, mental health is defined as a state of well being in which individual realizes his or her own abilities, can cope with normal stress of life, can work productively and fruitfully, and is able to make contribution to community. This is what mental health is. Before going forward, is my speed okay, sir? Hello?
येस मॅम, येस मॅम, येस.
Can
Yes,
somebody tell me my speed
पीपीटी
is okay?
पीपीटी दिसते मॅडम, हो दिसते.
Okay. माझा स्पीड ठीक आहे सर, मी खूप भरभर
हो
बोलतो.
हो हो दिसते मॅम, काही इश्यू नाही.
Fine, thank you. Okay. So, what is the importance of mental health? Everybody knows about physical health, but we very rarely think about mental health. So, why it is important? It includes our psychological and social well-being. It affects how we think, feel, and act, which is a very important thing in our life. Then it also helps us to determine how we handle stress, relate to others, and make healthy choices. And mental health is important in every stage of life. Many times people think once you grow old it's not important, but guys, at every stage it's a very uh, important thing. So what mental health is and what it isn't, always remember mental health is a part of everyone. It's a something to look after. It's real and complex. It's very important and it's something you can change. And what mental health is not, it's not a sign of weakness. Usually whenever person has a mental uh, health issue, it's always thought he is a very weak person, it's all in his head, he always thinks negatively, or he should be ashamed of it, something like that. But always remember, this isn't a sign of weakness, or it's not in your head, it's a very real thing. And something, it's not something to be ashamed of. So please remember these things. This is जस्ट अ मिनिट. एक कैवल्य, हे माझं पूर्ण आलं नाही दिसत, हे हल्लं का? हे हल्लं का? कनेक्शन इकडे यायला पाहिजे. Okay, I think I have some problem with my laptop, but okay. I will explain. There are three domains in psychiatry. First is a cognition, that is what we think. Second is a cognition, that is actions. And third is a affect. They are our feelings. So for a normal function, an equilibrium is maintained between these things. These three domains, they should be in equilibrium. Otherwise, we have mental health issues. So now, what is normality? Normality, it's not an easy term to define. We all know this, because something normal for somebody may not be normal for other person. So it's a very difficult term. But following traits are commonly found in normal individuals. First is reality orientation, then self awareness and self knowledge, self esteem and self acceptance, then ability to exercise voluntary control over your behavior, which is very important, then ability to form affectionate relationships, and pursuance of productive and goal directive activities. These are the few traits which are commonly found in a normal person. Pardon? Pardon? Hello? मध्ये आवाज
roll number 42, mute your mic.
Okay, let us continue.
Hello, sir. Hello.
आपलं कंटिन्यू करणं. आपलं शेअर स्क्रीन कुठे गेलं?
मॅम तुम्ही कंटिन्यू करा.
ओके, हे असंच राहू देत. फक्त मला पुढे देता येईल ना?
हा प्लीज फक्त मीटिंग
सर
मध्ये बोलू नका पार्टिसिपेंट.
सर स्क्रीन दिसतोय तुम्हाला?
मॅम दिसतोय पण त्याला पूर्ण हे करा मॅडम, फुल विषय करा
Yes,
मॅम.
ma'am. Full
फुल हे
screen
कर.
देईल.
ओके, फुल स्क्रीन कर.
Yes,
ओके,
ma'am.
फुल स्क्रीन कर. सर आता ओके?
No, ma'am.
ओके मॅम, ओके.
So we were here. There are a few models of normality. First is a medical model. This model considers normality as health. It's a medical thing, like it views it means absence of any physical or mental illness is considered normal. Second is statistical. Statistical is you should always be somewhere in middle of the bell curve. So when you are near that average, then you are considered normal. Then third is utopian model. This is an ideal model. It means it defines normality by ideal traits like maturity, self-actualization, subjective well-being, resilience, and strong emotional ties. Then comes subjective model. Subjective model is something what patient sees, what he thinks of himself. Does he think he has any problem, or he is thinking everything is normal? So this is the subjective thing. Then comes the social. Then comes the social model. Then the process model. Here this is considered as normality is considered as a process where it highlights individuals' goals, autonomy, self-determination, personal growth as a central part of being normal. And then is a continuum model. Continuum model we will see in the next slide. This is a mental health continuum. So it starts from being healthy, then reacting, then injured and ill. So when you are calm and steady, there are fluctuations in mood, but they are healthy fluctuations. Then I think we will go असं जाऊया आपण असं जाण्यापेक्षा. First is being calm and steady. When you go to reacting, you are easily agitated. In injured phase, there is a persistent anxiety and sadness. And when you have mental illness issue, there is excessive anxiety, fatigue, and sadness, and these symptoms are continuous. So then we say you are mentally ill. Then fluctuation in moods. Mood fluctuation is a normal thing. But when you are in a reacting phase, when you shift from healthy to reacting, you are easily angered. Then we are injured, you are not just angry, you react to that anger. And then in the ill phase, you get regular panic attacks. Then when you are fit, physically fit, you are well fed, you are rested, you are happy. When you go in that reacting phase, you are more frustrated and tired many times. In injured phase, there is a noticeable fatigue. And in ill phase, there are anger outbursts. This happens when you have mental illness. Then emotional control. When you go to reacting phase, you have difficulty in focusing. In injured phase, it deteriorates more. You have very poor concentration and severe memory lapses when you are ill. Then it affects your performance. You lose interest. Then in injured phase, there is inability to enjoy the things. And in ill phase, you can't concentrate and perform also. So that is what illness is. Same thing goes to your ethical behavior, social behavior, then about confidence in self and others, about your sense of humor. All these things are normal when you are healthy. Once you start going towards next phase, these things change. Next. This is a cycle of mental health. First, thoughts are in your mind. Those thoughts and beliefs are sources of our feelings and emotions. These emotions, they act as a driver to our behaviors or actions. And our behaviors, sooner or later, they will have consequences. Again, those consequences will reinforce our belief system. So this is the cycle. So if you change your thinking, you will experience a change in your emotions. which will influence your choices of behavior. So you will be choose, you will have healthy choices. Definitely your consequences will also follow this, and it will again reinforce your belief system. So changing the thoughts is very important. Now we will go to well-being and mental health. Positive mental health allows people to realize their full potential, cope with stresses of life, work productively, and make meaningful contribution to their communities. These are few pillars of mental well-being. What do we want? First is healthy habits. You should have balanced diet, you should be well hydrated, you should have enough sleep, you should do some physical activity. These activities, they boost your mood as well as they improve your health. Once you are healthy, you have healthy body and mind, then you should go for learning and purposes. Then you should set goals, you should learn new things, and then you will find meaning in all those things. Then connections. For being successful and healthy, you need strong relationships and social connections. So this is again one pillar. And mindfulness is a word we hear many times nowadays. So mindfulness is a paying attention to present moment and practicing gratitude. Whenever you are 100% in a present situation, it definitely keeps us relaxed, and it helps us in everything. So these are the pillars for mental well-being. Now, these are few factors which promote our sense of well-being. One is competency. I think these are very easy words. I need not explain them. Competency, contribution, comfort with change in life. This is very important factor. Nowadays, many people, they are not very comfortable whenever there is any change. They like a particular pattern. मुझे यही पसंद है, मुझे यही अच्छा लगता है. I am comfortable here. So that does not help. So we should be comfortable whenever there is a change. Then contacts and companionship, then healthy choices and commitment. Being committed is also very important when we are thinking about mental well-being. So now, well-being and mental capital. Mental capital is individual's cognitive capability, flexibility, efficiency of learning, emotional intelligence, and resilience in stress. Mental well-being is a dynamic state in which an individual is able to develop their potential, work productively and creatively, build strong and positive relationships with others, and contribute to their community. This mental capital refers to those elements of a person's psychological makeup that indicate how well an individual is able to contribute to society and experience a high quality of life through doing so. And it is enhanced when a person is able to fulfill his personal and social goals and achieve a sense of purpose in society. So this is what mental capital is. Then comes social capital. Social capital is degree of social cohesion which exists in a community. Now, how it helps well-being? The sociological viewpoint conceptualizes well-being as a relational and not a solitary experience, one that reflects in our interdependence within our family, friends, and neighborhood. Social support is assistance available to individuals or groups from within community that can provide a buffer against adverse life events and life conditions and be a positive support to enhance quality of life. Social support is very important whenever we have any issues in life. So social capital is quite important thing. And this social network is a relation between individuals that provide access to social support. Then, occupational perspective of well-being. Well-being can be seen as a well-doing or a net result of people striving to reach their potential through what they do. Our occupation must provide a meaning and purpose, as well as being a context for self-esteem and socialization. So, and range of person's occupation must include physical activity, intellectual challenge, spiritual experience. Please don't confuse spiritual experience and religious experience. So, spiritual experience, then experience of timelessness, emotional highs and lows, solitary and social experiences, effort and relaxation. So, your when your occupation provides you all these things, you are definitely in a good mental health. Now, this is a mental health statistic. This is something we should think about. 1 out of 4 people experience mental health problems at some time in life. 1 in 6 workers experience depression, anxiety, and stress. Depression affects more than other mental illnesses, and in India, nearly 4.5 to 5% people are thought to suffer from depression, and another 3% from anxiety. Why I have written are thought? Because many don't come for treatment. This percentage must be pretty high than this. And 14.3% deaths occur due to mental disorders. And depression is something we should be very serious nowadays. Now, this is mental health versus mental illness. So, what is mental health? Mental health is a state of well being, I told you, in which the person realizes his or her own abilities, can cope with normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. This is what mental health is. So, what are the indicators of good mental health? Self confidence, sense of well being, clear thinking, ability to take care of self and others. Then, of course, resilience, empathy, spirituality, flexibility, optimism, stable relationships, and sense of well being and contentment. These are the indicators of good mental health. Then, what is mental illness? Mental illness is defined as a health condition that affects a person's thinking, feeling, behavior, or mood. Such conditions may affect someone's ability to relate to others and function each day. So, what are those indicators? When do you know you are going towards mental illness or you are developing mental illness? Very first is pulling away from people and usual activities. These activities, they may be our day-to-day activities, our work activities, our social activities, any activity, they tend to pull away. Then feeling numb or like nothing matters. They absolutely don't care for anything. Then feeling helpless or hopeless. Then experiencing severe mood swings. Again, I told you before, mood swings are normal, but they should not be severe. Then thinking of harming yourself or others, means suicidal or homicidal ideas, and inability to perform daily tasks. Whenever these symptoms you can see, they are indicators of mental illness. So now, what is mental illness? Uh, Up till now, we were seeing what normal health is. Now we are going to our illness. For a person to be mentally ill, he should have symptoms which bother him or people around him and disturb their daily routine. Many times these things, they don't bother the patients because of his illness. He is not aware at all, so he thinks everything is normal, but when it is disturbing other people's life, you should think about it. So what are the features? First are disturbances in bodily functions. Patient doesn't sleep properly. Either he sleeps for a very long time, or he doesn't sleep or sleeps for a very less time. He has disturbed sleep. Then appetite. Again, not eating or eating too much, or not bothering, just being careless. Food intake, bladder and bowel movements, they are also affected in severe mental illness. And about sexual desire, either it is decreased, or in some illnesses it increases also, or patient doesn't get pleasure out of it. When I Whatever feelings you get after having a normal sex, they don't feel that happiness or relaxation, even after the sexual activity. So sexual desire. Then changes in mental function, your behavior changes, your talk changes, emotions, perception, memory, intelligence, judgment, and level of consciousness, in short, everything. Then changes in individual and social activities. Example, poor self-care. They absolutely don't bother even to brush their teeth or take a bath or wearing fresh clothes. Very simple self-care activities they ignore. Then neglecting bodily needs. That also includes these bladder and bowel movements I told you. Then not bothering to things causing pain or discomfort. I don't know you people whether if you people have seen a psychiatric patients. Many times they maintain certain postures. They don't change it at all, and they develop spasms, contractures, or stiffnesses in their joints, but they don't bother about that, they don't feel that pain. So this is again common. Then behaving strangely in home or society, and inappropriate or embarrassing behavior. A few examples of mental illness, they include depression, anxiety, bipolar is there are two phases, it is also known as mood disorder, manic and depressive. So bipolar, then schizophrenia, OCD, PTSD, and addictive behaviors, etc. These are the few examples of mental illness. Then there are few co-occurring conditions with this mental illness. Along with the mental illness, patient may have stress, fear or phobia, anxiety, panic attacks, depression, substance abuse with mental illness, and a few chronic health issues. They also many times they are also responsible or co-occurring with mental illness, like HIV or hepatitis B, which hepatitis B, then cancer. These are the few conditions which may be there with mental illness. Then what is the etiology? Etiology for mental illness is childhood abuse, trauma, illness. By illness, I mean some brain disorders, then social isolation or loneliness, then experiencing discrimination and stigma, including racism, then extreme poverty, then losing someone very close to you, severe or long-term stress and or long-term physical illness also, which mostly leads to depression. Then being long-term caregiver for someone, this is again a very important factor in mental hospital. In our OPD, we treat many caregivers also. They take care of their patients for such a long time, like more than 10 years, 15 years, 20 years. They also develop depression or anxiety, and we treat them for that. So this is again a very common reason. Then alcohol or substance abuse, then domestic violence and bullying, and then significant trauma as an adult, like being involved in an accident or combat or something like that, head injury, and neurological conditions like epilepsy, and genetic. Mental illness is genetic, please remember. Then these are few warning signs. I won't call this mental illness, these are warning signs. If you are eating or sleeping too much or too little, if you are pulling away from people and usual activities, occasionally it's okay to like being alone, not being with someone, but that should not be a regular process. Then having low or no energy at all, feeling numb or like nothing matters, having unexplained aches and pains. We have treated many low backache patients, chronic low backache. They are always treated better when they also consult a psychiatrist, because this is very common, neck pain and low back pain. Then feeling helpless or hopeless, smoking, drinking, using drugs more than usual. Social drinking is pretty common nowadays, but it should be in limits. And if you start drinking alone, then please think it as a warning sign. Then feeling unusually confused, forgetful, or on edge, or angry, or upset, or worried, or scared. Uh, Usually after 40s, people think being forgetful is a very common thing. That is true, but again, there has to be some limit. You should not be unusually forgetful. Then these are some serious signs, like hearing voices or believing things that are not true, thinking, like I told you, suicidal or homicidal tendencies, then inability to perform daily tasks like taking care of kids, going to office, work, doing our jobs in home, even traveling, then yelling and fighting with family and friends. Again, if this is in limits, this is normal, but otherwise it's not. Then experiencing severe mood swings that cause problems in relationships, and having persistent thoughts and memories you can't get off your head. These are all warning signs of mental illness. So if you have these signs, you must sit back, think about what are the reasons for happening so, and please don't hesitate to take professional help. Then these are few psychiatric disorders. I showed you those three domains. So any disequilibrium in three domains of psychiatry, they lead to psychiatric disorders. It's clinically significant psychological or behavioral syndrome that causes significant distress. Subjective symptoms are which patients tell us, ये हो रहा है, वो हो रहा है. Objectives are what we see, and which merely not socially deviant behavior or an expected response to a stressful life event. And conflicts between society and individual are not a psychiatric disorders. This is again an important point. These are few diagnoses. I told you about bipolar. Bipolar is a mood disorder. I told you there are two phases. One is elevated mood, that is called manic phase, and other is very low mood, that is depressive phase. And in between, patient is normal. But these extreme episodes, they are very extreme. Mania and depression, although both episodes, they are pretty extreme. So depression is a persistent feeling of sadness, anxiety, guilt, anger, or irritability. Depression patients, many times they have this severe guilt. I'm responsible for this. I did this wrong, so this is happening to me. So guilt is very common in depression patients, and anxiety is also common. Then isolation or hopelessness. Then disturbances in sleep and appetite, fatigue and loss of interest is huge. Patients are always tired, and they are not interested in any activity if they are having depression. And then morbid and suicidal ideation. Then comes mania. Mania is exactly opposite to depression. Here the individual will have increased energy, grandiose or delusional ideas, usually big talks like I'm Madhuri Dixit or I'm Modi, I'm a billionaire, something like that. One of my patients, he used to tell me, why are you working here for such a less money? I will pay you 5 lakhs per month. Come and join my company and all that. This is grandiosity. Then racing thoughts. Their thoughts, they race at a very high speed, very high speed. Then decreased need of sleep. They really don't need much sleep. They are always very energetic and happy. Then wearing dark makeup and bright colors. Makeup and liking bright colored clothes is not an abnormal thing. But again, like I told you, when it crosses the limit, you should think about it. And then spending large amounts of money. This is also a sign of mania. Then schizophrenia. Schizophrenia is a very major illness. This has very severe symptoms. First are hallucinations. Hallucinations is hearing voices. Somebody is telling me to do this, to do that, so I am doing so, something like that. They hear those voices. Delusions are false beliefs. Then comes paranoia. Paranoia, you all know. Then disorganized speech, irrelevant speech. Then disorganized or catatonic behavior. Catatonic behavior is they stay in that pose for hours together. And if you try to change that position, they you just can't do it passively. They may develop fractures, but they won't flex their limbs. This is such a severe behavior, catatonia. And then there are negative symptoms like emotional flatness, apathy, lack of speech, lack of concentration, learning ability, then completing the tasks. There are many negative symptoms. All these, they are present in schizophrenia. Then epilepsy. Epilepsy, we usually call it fits. Everybody knows it fits. So after epileptic attack, there is before and after the attack, there is a temporary confusion. There are staring spells. Their muscles become stiff. There are uncontrollable jerky movements of arms and legs. And there is a temporary loss of consciousness and awareness. And during this epileptic fit, patient may lose bladder control also. So this is epilepsy. And if you have epilepsy very regularly, if you have persistent attacks, it affects your cognition a lot. Then comes anxiety disorder. In anxiety, patient worry more about all the things, and snowballing worries means those worries, they increase very fast. Then difficulty in everyday activities, any activity, work, study, whatever, they find it difficult, or they feel stressed. How do I do this? I may be a failure, like that. Then they are always restless or on edge. They are very easily tired. Then they have difficulty in concentrating. Of course, they are irritable because they have anxiety. Then there is a muscle pain, sore jaw, sore back, sore trapezius, neck pain, all that. They have trouble in sleeping because they are restless, and they just can't relax. They have difficulty in falling asleep also. Then they have hot and cold flushes. Then racing heart, their heart rate absolutely increases, palpitations they feel many times, and tightening in chest. These are common symptoms of anxiety. Then comes the addiction. When to say you are addicted? When you are neglecting your responsibilities at school, work, or home, and it's because of your drug or whatever substance you're using, you are neglecting your responsibilities. Then you're using drugs under dangerous conditions, or taking risks while high, such as driving, or using dirty needles, having unprotected sex, um, even when you are trekking or climbing, riding, at that time having substance. Then when your drug use is getting you into legal trouble, such as arrest for disorderly conduct, driving under influence, stealing to support a drug habit, and your drug use is causing problem in your relationships, uh, at work, in with friends, in family. If you are having these problems, that means you have addiction. So what are the treatments for this mental illness? Very first treatment is, you should recognize and accept at an early stage, yes, I have a problem. And not only patient, their family members, they should also have that insight, and you should go to the psychiatrist. If you start treatment in early stage, they have very good results, and you need not take medicine for a lifelong. If you start it very early, there are many conditions where treatment can be stopped after few years. But otherwise, medicines for mental illness, you need to take them lifelong, right? Like diabetes or hypertension. So regular treatment, early recognition, and follow up, this is the most important thing in treatment. ECT, that is electroconvulsive therapy. This is used in severe mental disorder, like I told you, schizophrenia or bipolar. But this is used in very selected patients, because it needs physical fitness, and there are many other factors. So ECT is not a very commonly used thing. Then psychotherapy, family and group therapies, CBT, RBT, they help a lot in OCD and all, or even phobia, anxiety. These therapies, they are very useful. And then occupational therapy for cognitive, occupational, social, and family rehabilitation. So for rehabilitation, you need occupational therapy. When you have mental illness for a very long time, uh, everything is affected. In fact, your whole life turns upside down. So you need treatment and help in all the factors. So occupational therapy helps a lot in fighting negative symptoms. Medicines help in fighting those positive symptoms which I told you earlier, but negative symptoms, they don't respond to medicines much. So there you need occupational therapy. So if you want to be normal, completely normal, you need to go through all these things. Then recovery. So meaning of recovery can be different for each person. It may be about regaining control of identity and life. Having control of life is a very important thing for us. Then having hope, living a life that has meaning, Recovery focuses on gaining new meaning and purpose in life and being empowered and able to live self-directed life despite what one may have lived through. Although recovery is unique and personal, many elements are influenced by relationships and interactions between people as well as by social environments. So these elements often create barriers in recovery. So when I say barriers, what are the barriers in recovery from mental illness? Very first is lack of availability, affordability, acceptability, and accessibility to mental health services. Even today, in rural areas, we don't have these services. Means percentage is very low. Then treatment is pretty expensive if you take it in a private hospital. Of course, government hospitals treat you free, but otherwise that is bit expensive. Why I say acceptable? Because mental illness has severe stigma attached to it. We never accept or we never speak openly about it, having a person with mental illness in our house or even about us. So accepting that, uh, and few times even though patient thinks he needs treatment, family denies it. I have also seen such cases because they are worried about social stigma and all, and they think it's all in his head, he doesn't need it. So being denied these. And then negative effects of medication. Any medication that has effect has a side effect also. So even psychiatric medicines, they have side effects. So because of these effects also, many times patients tend to drop the treatment. Then lack of sense of identity, self-respect, hope, mistreatment, abuse, or trauma, this is again a barrier. Lack of educational, income generating, social or other opportunities. Then being excluded from family, not knowing about one's right, not allowed or trusted to make decisions for yourself any longer. This is a very common problem for us with our patients. They are never accepted in mainstream. Relatives expect them, even when they are at home, they are not supposed to speak when everybody is speaking. They are not supposed to be there whenever there is something going on. They just expect them to sit in a corner and not speaking and not doing anything. So being excluded. Then others defining what they see as a recovery. uh, Patient feels the recovery. He feels, yes, I can do this now, I have confidence in these things now. But relatives don't accept that. Once mentally ill, they always consider him as a mentally ill person. And there is totally opposite thing, overprotection. Means there is negligence, but at the same time there is overprotection also. So this is again a barrier in recovery. Then experiencing stigma, I told you. Then isolation, discrimination, and lack of support, and lack of contact with other people who have gone through and recovered from similar illness. Nowadays we all know about support groups. These support groups are very useful whenever you are suffering from any illness. But patients with physical illness have access to these groups, but they are very rare for mental illness. So lack of that support group, whenever you meet somebody suffering like you, and when you share your experiences, when you see what recovery another person is having, you feel confident, you develop hope. But lack of these support groups is again a problem with us. I told you there is a stigma attached to mental health. So how to reduce that stigma? Very first thing is encourage equality between physical and mental illness. Like there is a physical illness, there is a mental illness also, and they are not different. Please accept it. Educate yourself about mental illness as well as educate others. Do not label or stereotype people with mental illness. Then don't use disrespectful terms. Usually pagal hai is the term used, so please don't use such words. Then be positive, talk openly about mental health. Nowadays people famous people are talking about it. So yeah, people are trying to be open about it, but still we need to talk more openly. and show compassion and love for those with mental illness the way you show it for physically ill people. When you are with a cancer patient, or when you are with fractured or paralysis patients, you are very compassionate. But please show same compassion to mentally ill person also. He will recover fast, and that stigma will be reduced. These are few keys for normal mental health. First, brain healthy diet, quality sleep, meaningful and purposeful activities, social connections, staying active, and learning to manage stress. In our second lecture, we were going to hear something about this stress. So, these are the keys for good mental health. Then, providing appropriate support. This is again an important thing. First, pay attention. When somebody is speaking to you or somebody is telling you something, please pay attention, listen carefully, be patient, don't judge or criticize. This is a very common. We judge people very fast and we criticize more faster. So please try to stop that. Be forgiving. Forgiving is just not for the person who is opposite to you, but when you forgive somebody, you also feel relaxed. So forgiving somebody helps your mental health as well as his mental health. So please be forgiving and learn about mental health. These things, they are to support other people as well as yourself. Then feeling better. When you are stressed or you're having some problem, think about the time when you had to recover from something now or in past, and then how you did that. What were the things you did which helped you to recover? What emotional challenges did you have that time? How did you deal with it? What difficulties do you had while recovering? And what helped you get better and overcome that situation? Think about these things, recall them, they help you in feeling better. So, mental health, well being, and recovery are inherently personal. Respect for human rights is a key to protecting mental health. This is very important. Individuals and services can do a lot to support people in their recovery journey. Mental well being is important for both affected as well as not affected. And it is important that awareness increases in society so that affected people feel more at home and not forced to give their life away. I have deliberately put it in bold font because this is everybody's responsibility to spread that awareness about mental health and what are the facilities available and how to handle these things. So that awareness thing is very important. I request everybody to note down this number. This is a mental health program of Indian government. This is a 24/7 helpline. And you have psychiatrists, clinical psychologists, counselors, psychiatric nurses, and psychiatric social workers. They are all available. And they are skilled in basic counseling and crisis intervention. And yeah, you can select the language there. Your identity is never disclosed. You need not tell your name or from where you are speaking. And please remember, this is for crisis. For a regular treatment, you need to go to your psychiatrist or a physician, wherever you feel comfortable with. But this is for crisis. And because you're all lecturers, I request you to display this number on your notice board for students. We are having very good response to this program, and I'm very happy to share we have stopped many suicides. We have people calling, sir, I'm standing on a highway and I'm feeling like I should do a suicide now. There are so many fast moving vehicles, it's very easy. So it took our psychiatrist around 40 minutes to counsel that person, and finally he went home and he promised to go for treatment. But please feel free to call on this facility. There should not be any stigma attached to it or any shame because you are not disclosing your identity. So please display this number everywhere. So
Yeah,
thank you.
ma'am.
Thank you.
Mhm.
Now, any questions? आपण हा आता स्क्रीन शेअर
Ma'am,
करत.
can you check your slides are not moving?
What?
The slide is stuck.
Where is it stuck? What are you seeing, sir?
Models of normality, madam.
What? My. Why didn't you tell me early?
Ma'am, there were messages for like we were posting messages in the group.
Oh, I did not check it. I'm so sorry. You should have stopped me somewhere. Okay, so now you want me to go through those slides? Means
No,
I won't
ma'am,
speak
we
again.
understand.
I won't speak again.
This shows the
I will
number,
just
the
share.
helpline number which you were showing, ma'am.
Okay, okay.
Current
We
slide is
understood.
okay.
Once just the helpline
Current
number,
slide.
you can
Just
show
a
it to
minute.
us.
Just a minute. Just a minute.
Go for current slide.
काय होतंय रे? पण ते माझ्याच लॅपटॉपवर तिचा आवाज नाही आहे ना, त्याच्यावरच लावलं असतं. एकदम खालच्या स्लाइडवर ये.
एकच मिनिट.
ह्याच्यावरच पण डायरेक्ट ओपन कर ती स्लाइड. जा बरं खालपर्यंत एकदम.
दिसतंय का sir?
Can you see it now?
Yes, ma'am.
Just a minute. Now I will go on that slide. शेवटी आहे ती स्लाइड. Can you see it now, sir?
Yes.
Yes, ma'am. Slides are visible.
Yes,
So
ma'am.
please copy this.
एकदा पटकन गो थ्रू करायचं का?
And if you want, I can move those slides again for you. त्यांचे मेसेजेस कुठे आहेत? ओके, इथे जाऊन थांबले. ठीक आहे. Okay, so any questions or should we stop?
Slides दाखव. काय करायचं?
त्या वरच्या स्लाइडवर जावं लागेल आपल्याला परत. ते झालं होतं आपलं. नाही, मॉडेलवरच थांबले होते म्हणले ते. ओके, इथेच थांबलं होतं असं म्हणले ते.
जस्ट 10 सेकंद
सांगू का त्यांना?
विचार.
हॅलो.
Yes, ma'am.
I think slides were stuck here. Okay.
Yes, ma'am.
So I will just move them quickly. If you want to see any particular slide, tell me. Otherwise, I will just move it in 10 seconds.
Okay, ma'am.
And please, instead of typing, tell me verbally. I'm more comfortable with that.
Okay, ma'am.
स्लाइड्स त्या किती वेळ चालतील? So okay, thank you. आता यांनी काहीतरी बोलावं माझ्यापेक्षा.
सर आभार ये करूं क्या मैम बोलने वाली?
नहीं, अभी अगर आपको कुछ पूछना है तो आप पूछ सकते हैं. नहीं तो हम रुक जाएंगे and then we will have a 10 minutes break or what? 10-15 minutes, how many minutes do you want?
ओके मैडम.
हाँ, तो कितना 15 मिनट्स का ब्रेक लेंगे या 10 मिनट्स का लेंगे?
It is up to you, ma'am.
Okay, I think then 10 minutes are enough.
Okay, okay.
And then we will start stress management.
Sure, ma'am. Sure.
Okay,
Okay, ma'am.
fine. Thank you very much. Thank you.
Thank you.
चॅट मध्ये काय आलंय बघ बरं. काय येस मॅम. आपण माईक ऑन केला.
हो.
हॅलो.
Yes, ma'am.
Yes, ma'am.
Sir, whenever you are ready. Should I start?
Yes, ma'am. Yes, ma'am.
Yes, ma'am.
Okay. Okay. Thank you, sir. So, our next topic is stress management. Very hot topic nowadays. Very first thing is stress is a normal phenomena. We need to accept this thing from beginning. It helps in achieving success. Excessive stress can interfere with your productivity and impact your physical and emotional health. And your ability to deal with it can mean the difference between success and failure. You can't control everything in your work environment, but that doesn't mean you're powerless. Even when you're stuck in a difficult situation, there is a way. And finding ways to manage workplace stress isn't about making huge changes or rethinking career ambitions. It's about focusing on the one thing that's always within your control. It's you, it's us. So, let us speak about stress. We are speaking about workplace stress here. Now, stress can be physical, it can be chemical, it can be emotional. So, physical stress is your illnesses, some problems. Chemical stress is when there is a substance abuse and all. Stress because of that is a chemical stress. And emotional is very strong events, bad events, sad events in your life. That is emotional stress. Stressor is a chemical or biological agent or environmental condition or an external stimulus or an event that causes stress to an organism. So what are environmental stresses? Very elevated sound levels. These are very common nowadays and we really feel irritated with them. Over illumination, laser lights is the best example, and overcrowding. Another example of over illumination is our mobile phones. In the nights, it's very common nowadays to spend some time with your cell phone, and screens are very bright, and then you don't fall asleep very easily. That is because of that over illumination, which is stressful. Then daily stress events, traffic, lost keys, quality or quantity of physical activity. These are daily stressors. Then life changes, like I said, sad or something like divorce, losing partner, breakups, losing jobs. Then there are workplace stressors, very high job demand versus low job control, repeated or sustained exertions, forceful exertions, and extreme postures. Especially people who work on laptops for a very long time, that is extreme posture. Or doctors who stand for a very long time, police, these people they face extreme postures. Then chemical stressors, tobacco, alcohol, drugs, and so. And social stressors, that is social and family demands. So these are all the stressors which develop stress in our life. There are different types of stress. One is positive and negative. What is positive stress? Positive stress is uh, some upcoming event like a marriage, or you are going abroad for studies, or you are pregnant, or you have to participate in some competition. This is a positive stress. You have stress during that period, but end is very sweet, so that doesn't affect you. It's actually good. Then negative stress is relationship problems, unemployment, accidents, death, and so, or some chronic illness. Then there is another classification, acute and chronic. Now this acute stress, uh, it comes from recent past or near future. And means when you are driving in a very crowded area, or you have gone hiking, uh, uh, means these they give you some thrill, something like that. And this is a very short term stress. Acute stress is short term stress, and men deal better with that than women. So this is that. And then comes the chronic stress. Chronic stress is, it comes when a person can't see a way out from stress. And this is a very long term thing. It wears you off day by day. And women handle this stress better than men. So this is acute and chronic. Then what stress does to your health? So you can see it affects each and every system in our body. In our brain, you have depression, anxiety, insomnia, low energy, migraine, all because of stress. Migraines is very common nowadays, and low energy. Then you have hair loss and hair thinning, affects your hair. For muscles and joints, you have pain, tension, fibromyalgia, fluid retention. Again, for pain, I told you previously, neck pain and low back pain is very common when you are stressed. Then heart, you have irregular heartbeats, you have palpitations, you have heart disease. Then stomach, ulcers, malnutrition, malabsorption, anorexia is not feeling hungry, constipation, irritable bowel syndrome, or inflammatory bowel disease. These are effects of long term stress. Then weight gain, usually when you have more fat around your middle of the body, that weight gain is due to stress. Then on your skin, early aging, acne, eczema, psoriasis, allergies, they are all aggravated by stress. Then neck, hypothyroidism, sore throat, mouth ulcers. Hypothyroidism, if not treated, it has a symptom, depression. It also causes depression. So hypothyroidism is very much related to stress. Then for our arteries, high blood pressure, cholesterol, and stroke. Lungs, cough, cold, asthma. Liver and pancreas, liver disease or diabetes. Sex glands, premenstrual tension, irregular periods, low libido, that is sex drive. Then prostatitis, that is inflammation of prostate gland in males, and night sweats. So you can see stress affects each and every system in our body if not treated or handled correctly. Again, there are some warning signs. Nothing comes directly. Every illness, every event in body, it has got some warning signs. So what are the warning signs for excessive stress? Feeling anxious, irritable, or depressed, apathy, loss of interest in work, problems in sleeping, fatigue, trouble concentrating, muscle tension or headache, stomach problem, social withdrawal. You don't feel like meeting anybody, you don't feel like going out with friends and all that. Then lack or loss of sex drive, and using alcohol and drugs to cope. This is again very common in our society. People think alcohol is the best remedy for handling stress. For some time you feel better because of effect of alcohol. Your inhibitions, you don't have much inhibitions. When we don't have inhibitions, we are very happy and stress free. So for short period, alcohol, you feel like you are feeling better with alcohol, but in long term it causes more stress. So don't use alcohol for stress management. So these are few common causes for excessive workplace stress. First is fear of losing our job, erratic hours or more overtime due to staff cutback, pressure to perform to meet rising expectations but with no increase in job satisfaction or salary, then pressure to work at optimum level all the time, then long travel distances, which is very common in cities, unavailability or insufficient resources. I work in a government institution, so this is always a problem for us. I don't know about you people. Maybe you don't have to face this problem. Then bullying by colleagues or boss, inadequate salary, and gender bias. Even in 2026, we still have gender bias. So there are few stages how we respond to stress. First is alarm reaction. It prepares us to fight or flight response. I will tell later what fight or flight is. Second is adaptive or resistive phase. Here, our body returns to its pre excited phase, it adapts to that stress. Then, exhaustion phase. It is reaction to constant high metabolic response of resistive phase. In this phase, body's neurophysiological ability to react to stressor effectively is no longer present. And at this phase, your stress turns into chronic stress. So, what are our responses to stress? Fight. Whatever issue we have, we are ready to fight it. Then flight. We we turn our back to it. We try to distance us from that situation. Freeze. We absolutely don't speak or don't react. We just go still and silent. Flop. Flop is a freezing, but your body gets floppy. Means like if you are traveling in a jungle and you see a tiger and you are very frightened, now he's going to attack you. There, your response is your body goes floppy. You just can't move your body. Then friend, that is calling for help. These are responses to stress. Then how to recognize when you are stressed. So just think about it. Are your muscles tight or sore? Is your stomach tight or sore? Are your hands clenched? This is a very common response to stress. We just clench our hand to fist like. Is your breath shallow? This is shallow breathing is very common. We always say take a deep breath. So shallow breathing. When you are tired, your eyes feel heavy and you might rest your head on your hand. This is very normal if it is occasionally, but if it is becoming a routine, then you should think about it. And very important thing about any illness is accept you have it. So accept it if you are stressed. Mostly people deny the stress because they want to show everybody how strong they are and how manly they are, and they are never stressed or so. So don't deny that, accept it. We respond to stress in different ways. Some become angry, some agitated, some withdraw, and others freeze up. So manage stress by learning how to take charge of your thoughts, emotions, environment, and way you deal with problem. Otherwise, this happens, whatever I have shown in picture. So before that, take action. What are basics of stress relief? First is regular exercise. Everybody knows exercise is a mood booster. It secretes hormones in our body which keeps us healthy, relaxed, and happy. Healthy body, healthy mind. So regular exercise. Then healthy food. We will discuss this in next few slides. Then enough sleep. Nowadays, getting enough sleep is becoming rare day by days because we have started spending more time on social media or those reels or podcasts or what. So enough sleep, at least 7 to 8 hours sleep is very important for us. Then talking to someone who listens. This is again a very important thing, but who listens is underlined. Then importance of laughing. Then healthy sex life. What I mean by healthy sex life is always you should, if you want to have pleasure from sex, you should have protected sex, and secondly, be faithful to your partner. Otherwise, such joyful activity, it will add stress to your life. Then being spiritual means the activity which helps in releasing all your stress, which makes you happy, where you forget everything about your surrounding. So that may be different for everybody. For someone it may be music, someone it may be drawing, some people like reading, writing, some people are religious type, they find their spirituality there. So find out what is your spirituality and be spiritual. Drink alcohol in moderation and avoid nicotine. Nicotine has a very bad effects on your body, so please avoid it. And definition of moderation will also change from people to people, but drink in moderation. So self awareness, self regulation, and self control, these are three very important things if you want to manage the stress. Now, positive use of emotions. Learn to manage and use your emotions in a positive and constructive way. For that, you need to have self awareness, self management, social awareness, and relationship management. So, what are the tools for stress management? So, physical tools. Physical in physical tools, slow controlled breathing, simple body movements, these are some physical tools for managing stress. Then nutrition, exercise, sleep, biofeedback. Biofeedback is that mind body technique to control your body functions, like heart rate, breathing, and all. Means wearing a Fitbit or some instrument like that, that is biofeedback. Then massages, they are very good relaxants, and progressive relaxation. These are the physical things. Then cognitive, here about thoughts, self-talk, meditation, imagery. Imagery is imagining some happy things, things which give you pleasure, which keeps your mind relaxed. So imagining those things. Refocusing strategies and systemic relaxation, these are tools for stress management in cognitive way. Then behavioral, you should be assertive, you should learn time management, you should not hesitate in using support groups and segmentation. These are the behavioral tools. So skills required for positive use of emotion, I told you to use your emotions. So first, realize when you are stressed, stay connected with your internal experiences, recognize and effectively use body language. Body language is very important, we all know. So recognize and effectively use it. Meet challenges with humor and resolve conflict positively. This is the way. These are the skills you will require for using your emotions to fight stress. Now, time management. First, create a balanced schedule, which is very important, at home as well as in office. You must have a balanced schedule. Um, then don't overcommit. Many times people do it to please somebody, or they think they will move faster on a ladder if they overcommit, but that puts terrific stress on you. Try to leave early in the morning. This is a very simple thing. If we leave our home in time, we don't have tension of traffic, we drive very comfortably, we reach in time, so we can plan our work also. So leaving earlier in morning is very important, and plan regular breaks. Always work and work, it won't help you. So you need to plan breaks, go for trips, have some visit a spa, spend time with friends, or spend time in your hobby. So regular breaks. Then comes task management. Task task in task management, first decide priorities. What is to be done earlier, what is to be done later. Here, if you have some work which you don't like but you need to do that in the morning. It is less stressful. And whatever you like, do it in the afternoon or evening. That way it works better. Then don't try to do everything in a one day. Whatever is important, just decide how to do that. So decide priorities, break projects in small steps, and delegate it to people. He may not do it in a way you are doing it. You may be better than him, but you need to delegate some responsibilities, and you can't be perfectionist all the time. It puts stress on you. And then be willing to compromise. However smart you are, uh, you always can't get everything. So sometimes you need to compromise, you need to take a step back and be willing to do that if you want to live a stress free life. I am not saying don't do your jobs properly, but whenever necessary, you should be ready to compromise. I like this picture, so I have put it here. Sometime it happens, we are in a situation which is not very pleasant. We are in a fighting mode, and people get hurt. We also get hurt. Opposite person also gets hurt, and it just damages the situation. So once in a while, this is also a good thing. Just turn around and live quietly. But this should not be routine. This is once in a while. It's okay. But I just liked it, so I put it here. Then reduce job stress by breaking bad habits. Resist perfectionism. I told it in the last slide also. Nothing is perfect, always remember. So resist perfectionism. It puts a lot of stress on your body as well as mind. Clean up your act. Your table should be clean. Your laptop should be clean. It should not have all those junk files and all. Your office should be clean, your home should be clean, wherever you are, uh, whatever you're doing, clean up after you complete. Then flip your negative thinking and don't try to control the uncontrollable. Every situation is not under your control, and whatever you do, you can't control it. So whenever that is an uncontrollable thing, just leave it. These are few ways to dispel stress at work. Take time away, talk it over with someone. This someone should be such that he should not go and tell this to everyone. He's suffering this, he's doing this, he's doing that. So that someone should be your really good friend or relative or partner, whoever. So talk it over with someone, connect with others at work, and look for humor in the situation. These are few ways to dispel stress. Now, this is for bosses. First, improve communication. Consult your colleagues and subordinates. Although you are a boss, you are taking all the decisions you should take, but consult your colleagues and subordinates. They should also feel they are being respected. You are listening to them, which is very helpful to keep the atmosphere stress free, and cultivate friendly and social climate. So, this is what boss should do. Then now I will come back to exercises. I told you exercise is very helpful in reducing stress. So a 10 minutes walk can improve your mood for 2 hours. So if you exercise 35 to 40 minutes daily, it keeps you happy whole day. So if you want to have a good mood, exercise very regularly. Choose activity that are moderately intense. Many people think if they go to gym and sweat very regularly, it will help them. But sometimes it puts unnecessary pressure on your body, and you are tired, or you get injured, and then again stress increases. So moderately intense exercises, aerobic exercises have very good mental health benefits, but you don't need to sweat strenuously to see results. Always remember this. Light exercise also helps. Find exercises that are continuous and rhythmic rather than intermittent. Any rhythmic and continuous movements, it relaxes you. Think about rhythmic movements you do daily, like see walking, swimming, dancing, even biking. Movements are rhythmic and repetitive, and then you really feel relaxed with them. Yoga is also very good choice if you want to relax. And mind body element, yoga, it helps you in resting your mind, it increases your energy. You so that is again a good choice. Start slowly, don't overdo it. Always remember, more isn't better. Athletes who overtrain find their moods drop rather than lift. Always remember this. And those things, they are for temporary period, not permanent. So never overdo. It puts additional stress on you. Now food. Never skip meals. They put lots of stress on your body and mind because you become irritable, you feel tired, and then what you do, you eat anything and in a larger portions. So have small portions at a regular period and have healthy food. It will help you. Minimize sugar and refined carbs. uh, Sugar, we Indians, we are addicted to sugar because from childhood we are served too much of sugar. So sweet cravings are very common in us. And what we do, not feeling well, eat something sweet, you will feel better. You are tired, have some sugary snack, you will feel better. This is what our system is. So you feel better for very small time, but that is not the way to reduce your stress. So these feel good foods, they quickly lead to a crash in mood and energy. They are they help you for a very small period. So minimize sugar and refined carbs. Focus on complex carbohydrates. They boost our serotonin level. Serotonin is a hormone which keeps us happy. Then boost your vitamin B intake. Vitamin B deficiencies, they trigger depression. Then you have sore muscles or sore body. B12 deficiency, you have again some tightness in muscles if you have B12 deficiency. So B complex is very important. uh, you can have it from milk, curds, green vegetables, beans, chicken, eggs. These are all very good sources of vitamin B. So always have it in good portion. Then try superfoods. They are rich in nutrients and they boost our mood. I have given few examples here. Bananas. Banana is a superfood, very cheap and very easily available. So unless you have been advised not to eat bananas, go for them. Bananas have magnesium. It decreases anxiety. Banana has vitamin B6. It promotes alertness. Tryptophan, it boosts serotonin levels. Then brown rice, again serotonin and thiamine to support sociability. Spinach, magnesium, folate to reduce agitation, and it improves sleep. So go for these superfoods. Consider taking a chromium supplement. It reduces cortisol. It is said it reduces cortisol level. Cortisol is a stress hormone. But I have written with a red color with physicians consult, because this chromium, it has benefits in stress management, but it is very dangerous also. See what are the benefits. It elevates your mood, it regulates your cortisol, it acts as a metabolic support. But there are few illnesses where you can't have chromium. If you have liver or kidney issues, you should not take chromium. Then there are very serious dangers, kidney liver damage, blood disorders. Chromium leads to a low platelet count if it is not taken properly. Low platelet count is very bad for our immunity. Then in neurological symptoms, it affects your concentration. Then it impairs your thinking. Then you may have hypoglycemic attacks. So however helpful chromium is, never take it without consulting your physician. Please remember this. Remember that red color. Then omega 3 fatty acid. Omega-3 fatty acid, it has a very essential role in stabilizing our mood. For omega-3, best, it's a good food for our brain also. It has antioxidant effect also. Fish is a best source, but for vegetarian people, vegetable oils, walnuts. Again, walnuts. If you are exercising, then eat walnuts. Otherwise, it increase. It help means you will gain weight. So do regular exercise and then eat walnuts. Flax seeds, soya bean, tofu. These are few vegetarian sources for omega-3. Of course, you get supplements for all these things, but it's always better to consume it in a natural way. If necessary, you can take supplements, but with your doctor's advice. Then selecting food. Don't select junk foods. Eat more fresh vegetables, fruits, whatever you get fresh, home cooked food. Then we will shift to using our senses to reduce the stress. These are our senses, how they help us, how vision or sight will help us. You could put a photo of your kids or your parents or your pet, somebody you love, as your what do we call it? काय म्हणतो रे आपण ते स्क्रीनवरचं आपलं असतं त्याला. You can put it on your mobile screen, or you can put a frame in your office, or okay, wallpaper I meant to say, or you can have some very good frames on your walls, or those artificial waterfalls. Just by looking at them, you feel better. You must have observed, when we look at a water body, at a sea or a river or some pond, we feel good. So that is good for our sight. So use your sights as a stress buster. Sound. Listen to some good music which you like, or talk on a phone with someone you love. About this music, about sound, I will like to tell something. Especially when we are driving, we tend to listen to radio or something like that. But instead of those radio jockeys, go for plain music, because they talk so constantly that affects you, that doesn't help you in releasing stress. So listen to some soft quiet music, or sometimes just driving silence is also good sometimes. So this is how we can use sounds. Then smells and scents, they always freshen us. Use perfumes, use some good agarbattis or air fresheners, whatever you like. Whenever you or fresh flowers, whenever you have some good smell, it freshens up. Then touch. Mm, you can do this, just rub your palms, or you can stroke your pet, you can hug your kids. Touch is very good. You can hug your parents. All these touches, they are very good stress busters. Remember how happy we feels when our kid comes home from school and says mama, how do we feel? So touch is very important. Then taste. Eat some good food, something you like. uh, it also helps in reducing stress. Dark chocolates are known for good stress busters, but of course they are chocolates, so in limited portions. And then movements, simple body movements, they help us in reducing stress. Even when you are sitting in an office, you could move your you could wriggle your toes, you could move your fingers, or you could just straighten your back. Very simple movements, but they help you in reducing stress. And if possible, after an hour or two, just stand and have a very small walk, or stretch yourself. These movements, they help you in reducing stress. Then take a break from technology. Try, I've told you about music, uh, relaxing music. Then yeah, if you're stuck in a long line, instead of looking at your phone, just watch people, or watch whatever wherever you are. Pay attention to what you hear and see. People of my age, please remember, we didn't have any cell phones or televisions when we were kids. But whenever we used to wait in a line, what we used to do? We just used to observe whatever is going around us. Remember railway platforms, what we used to do there when we used to wait for railways and all. So pay attention to these things. If you try to take break from those mobile phones, then even in a meeting, when you are waiting for a meeting to begin, instead of checking email or instead of using those WhatsApp chats and all, or Insta, whatever, take few deep breaths, look out of window, have some tea, have some water, or just talk with your colleague. It helps in reducing stress. Resist urge to text, what I told you. Then these are few quick stress reliefs at work. You are sitting in a meeting, it's for a very long period, so just wriggle your toes. Do some static contractions, contract your knees in sitting position, or just straighten your back and sit straight, adjust in your chair. So those small movements, they relax some tension in your muscles. Or if you are constantly looking in your laptop or some screen, after say 20 minutes, just focus on something which is at a longer distance. Then again, you look at your screen for a minute or two, just focus on some object on longer distance. It reduces stress on your eyes as well as your forehead and brain. Then during lunch breaks, instead of using mobiles, you could have a just stroll, just have a stroll, simple walk. It helps us. And at your workspace, whenever you are alone, you could always do stretches. Stretch your neck, stretch your back, stretch your shoulders. Then you could stretch, if possible, your knees and hips also. So body stretches, if possible, do it at your workspace also. It helps a lot. You can do stretches while sitting, while standing, so it's not a very difficult thing. Then stress relief at home. Increased tolerance and patience. I know many of you must be laughing after reading this. Increased tolerance and patience. We always think we are very patient, but we usually are not. Then spend time with family. Involve yourself with kids and their activities. Ask them what they did at school, what happened with their friends, what are they doing. If when they are young, help them in their projects, so they feel happy, you also feel happy. Open up with spouse, show interest in his or her world. Usually what happens, what I have observed, if a wife is not working, she is a housewife, and a husband is working for a very long period, he does not do it deliberately, but usually he is not interested in whatever she is doing whole day at home. And after coming home, he again expects, "See, I'm tired now, so she should uh, be available to me." Just try asking her what she did, how was her day, what are her plans for next week. Just show some interest, she will be very happy. And I need not tell you, when your spouse is happy, how happy you are. Then connect with relatives, attend family functions. This is again very important. However busy you are, please try to attend them. They are very good stress busters, and it helps you in maintaining your relations also. We need people. Then plan outings on weekends instead of just sleeping for a very long time at home. I won't get up from bed until 11 o'clock because it is Sunday. Please don't do that. Instead, get up and go for a walk. That will be a very good thing. Go for a small trek. Then pursue hobbies. Usually, when till we are learning, everybody has some hobby. But then we start working, we get married, we have so many responsibilities. Those hobbies, we just stop doing all those things. So please give some time for those hobbies. They are very good for stress relief. Then involve yourself in a social work group or eco-friendly groups and experience joy of giving. Try to remember or try to imagine there is a blood donation camp and you go there and donate some blood. It's a very simple activity, but how happy you feel after that, because you have saved somebody's life. Or some old person or blind person is standing to cross the road, you help him cross the road, you feel happy whole day. So these are very small things, but joy of giving, you need not spend lots of money or that, or you need not spend lots of time or energy on that. These are very small things, just try them. Everybody can find whatever they can do or want to do, but there is tremendous joy in giving. Learn to empathize with deprived ones, which will make you happy in given resources and condition. That's what I was telling you. Then take time out to meet friends. They are best listeners. This is the best part of having good friends. You can't speak about everything to even to your partner or your relatives, but your friends are somebody with whom you could speak about anything and everything. They are very good listeners, and they won't go out and tell everybody whatever you have told them. So you will feel relaxed. So you must have good friends. Then things to do for not having stress. Plan tomorrow. As a working woman, what I have done my whole life, before going to sleep, I plan whatever I'm going to cook tomorrow, at what am I wearing tomorrow, what time I'm leaving the house, and what time I should reach the office. So plan everything. If you have planned everything, you save time. You need not open the fridge and look at all those 10 vegetables. What should I cook today? Then how should I cook it today? What should I tell my maid? So planning is a best strategy. Don't get up in a hurry. Do stretches in bed and recall day schedule. This is again a very important and very simple thing. Usually what happens, alarm goes on, we just shut it off, we sleep for 5 more minutes, 5 minutes more, and it turns to 15 minutes and then we are late. So with a very jerky movement, we get up from bed and we start running. But in that phase, we hurt our back many times, or we lose the balance because we are moving very fast, or you may sprain your ankle if you do very jerky movements. So before getting up from bed, do simple stretches in bed, whole body stretches. They help you to relax a lot. Then recall whatever you are going to do today. What is your schedule today? It will take 5 minutes, but you will be very relieved and relaxed and you will have a good day. Then prayer or some happy memory, it again relaxes us. So whatever you like, if you want to say some prayers, you could say them, or remember something which you like. Personal grooming is again very important in stress management. Always wear clean and uh, the clothes which you like. I won't say expensive ones, but the clean ones. So you should feel fresh, you should smell fresh. Then whatever makeup, jewelry, whatever you like. But personal grooming is very important. When we look in the mirror, we must feel good, and opposite person should also feel good. So personal grooming is very important for men as well as for women. It's not only for women, please remember. Then regular massages, manicures. Having massage, it relaxes your whole body. It improves your blood circulation. Then it helps in draining all those bad things from your body. So regular massage always helps our body as well as mind. So, and again, that touch, I told you about touch in stress management. So that person touching you in those rhythmic strokes, that is also very helpful. So regular massages and manicures, they are very helpful in stress, relieving stress. Just look at the happiness on their face. Plan holidays. Yes, they are always good relaxation things. Don'ts for stress management. Uh, Unnecessary overtime. Working at home. Please, whatever you have to do it in your office. Rarely it is okay to work from home, but don't make it a habit. Don't take work to home. Once you are out of that gate, you should be out mentally also. Then denying stress. I don't have any problem. I can handle everything. I'm perfect. My life is perfect. Nothing is perfect. Please remember. So don't deny stress. If you have stress, accept it. Yes, I'm stressed. I'm trying to fight it. People may help you. Using alcohol, nicotine, or drugs as stress busters, which is very harmful. I told you, if that they are used in a large doses, they are very powerful stressors. And substance use, uh, unlimited substance use, it also affects your brain. You have mental illness symptoms, behavioral problems, and mental illness with this addiction. We have a separate ward for addiction. So please, don't use them as stress busters. They are never stress busters. And denying professional helps. Why do I need psychiatrist? Why do I need a counselor? I can manage it myself. No, when after doing all these things, when still you are having some issues or you are showing some warning signs, don't hesitate to seek this professional help. This is a pyramid for stress management. First, very important base things are time management, exercise, healthy eating, and relaxation. Then relationships and your viewpoint. It is again very important in stress management. And then spiritual integration. So these are the components of this pyramid. And after doing all this, if you are still stressed, never ever give up. This is a very wonderful picture. You can see what is it, but never ever give up. Seek professional help. Know when to get additional help. If you find depression getting worse and worse, please go to psychiatrist. Needing additional help doesn't mean you are weak. Sometimes negative thinking and depression can make you feel like you are a lost cause. But depression can be treated and you can feel better. All these mental illnesses, they have treatments, and depression is very much treatable. So please accept it and seek help. Don't forget about these self-help tips though. Even if you are receiving professional help, these tips can be a part of your treatment plan, speeding up your recovery and preventing depression from returning. So those tips are very important. You need to follow them even though you are having professional help. Again, this telemanas, I showed you this slide in last presentation also. They are always there to help you. So if you do this, this is what we can do. So stop stressing and start living. Any question, guys? Hello? Hello?
Yes, ma'am. Hello.
Where can I see those messages? काही वेळेला messages कुठे दिसतात रे इथे? मगाचाच आहे का काय? मगाचेच आहेत नाही? नवीन नाही ना काही? Okay. Fine. So any questions? Or should we stop? का नहीं येत आहे? Thank you, ma'am. No, ma'am. Great. Great. Yes, thank you. Fine. I'm very happy. There are no questions. My teacher used to say, when you don't have any questions, either your lecture went so well that everybody understood everything and they're happy with it, or they haven't learned anything about it. So, so I will go with the first one, and I'm very happy. Yes, thank you very much.
Yes, ma'am. We have understood. You will go for the second one.
Thank you very much. So, should we stop, sir?
Yes, ma'am.
Yeah, somebody is asking me, ये PPT मिलेगी क्या? But whom should I share it?
Is it possible to share on this WhatsApp in this chat also?
Pardon?
I think we should work with this host and then let you know.
काय म्हणतात ते?
आपण या चॅट मध्ये शेअर करू शकतो.
Okay, I will try that. त्यांना माझा फोन नंबर कळत नाही ना.
हॅलो मॅडम,
Yes.
स्ट्रेस मॅनेजमेंट हा पीपीटी पाहिजे होती.
हो, पण ती मी कशी शेअर करू ह्याच्यावरून मला कळत नाहीये. मी चॅट मध्ये टाकायचा प्रयत्न करते. 1 मिनिट थांबा. मी ती
मैम चैट में पीपीटी नहीं जाएगा, मैम चैट में पीपीटी नहीं जाएगा, आप सर के साथ शेयर कर सकते हो. सो सर विल शेयर दैट पीपीटी विथ अस
नाही,
इन आवर व्हाट्सएप.
एक मिनिट सर, मी चॅट मधून ते शेअर करून बघतेय. ती मला तरी गेलेली दिसतेय. बघा, तुम्हाला दिसतेय का?
No, yes, ma'am. It's 1.4 MB.
Yes ma'am, sorry, we have received.
Got it.
Oh, आली मॅडम.
गेली ना?
थैंक यू.
Yes,
Oh.
yes, ma'am. Got it.
तीच शेअर वालीच पाठवायची होती. गेली ना ती?
मेंटल हेल्थ
नको.
Download and let us see that it is working next time.
Yeah, otherwise, your professor has my phone number. त्यांनी म्हणलं तर मी त्यांना शेअर करीन and you can get it from him. इथे तर मी टाकलेली आहे. I hope हे सगळं आलंय त्याच्यामध्ये.
Yes, ma'am.
Okay.
It's there.
Thanks a lot.
Yeah. We got the video.
Okay. So, thank you everyone.
Thank you very much, ma'am.
Yes. Leave.
हॅलो हॅलो सर. हेलो. हेलो.
Yes, sir.
मैं आभार ये करूं मैडम.
हाँ, बिल्कुल.
थैंक यू. 16वें ऑनलाइन फैकल्टी इंडक्शन प्रोग्राम के सफल आयोजन हेतु मैं डॉक्टर बाबा साहेब अम्बेडकर मराठवाड़ा विश्वविद्यालय छत्रपति संभाजी नगर तथा यूजीसी मालवीय मिशन टीचर ट्रेनिंग सेंटर के माननीय कुलगुरु महोदय, आदरणीय निदेशक महोदय, समन्वयक, सभी सम्माननीय संसाधन व्यक्तियों, कार्यक्रम के आयोजक मंडल तथा तकनीकी टीम का हृदय पूर्वक आभार व्यक्त करता हूं. आज के इस ज्ञानवर्धक सत्र हेतु हमारे संसाधन व्यक्ति डॉक्टर स्नेहल शास्त्रकर का विशेष आभार, जिन्होंने अपने बहुमूल्य अनुभव एवं विशेषज्ञ मार्गदर्शन से इस कार्यक्रम को अत्यंत सार्थक बनाया. साथ ही इस कार्यक्रम में सहभागी सभी माननीय प्राध्यापकों, प्रतिभागियों एवं सहकर्मियों का सक्रिय सहभाग और सहयोग हेतु मैं हार्दिक धन्यवाद ज्ञापित करता हूं. अंत में इस कार्यक्रम के सफल संचालन में प्रत्यक्ष अथवा अप्रत्यक्ष रूप से सहयोग प्रदान करने वाले सभी महानुभावों को एक बार पुनः सादर नमन करते हुए मैं अपनी वाणी को विराम देता हूं. धन्यवाद.
Thank you, sir.
थैंक यू.
हेलो हेलो सर, बुक रिव्यू के लिए ईमेल भेजिए ना सर।
So can we leave the meeting?
सर देवेंद्र मेश्राम सर है। हेलो मेश्राम सर है सर।